to Virginia right now. Here's my mom.
Good morning.
And we're going to see a jaw specialist who my neurosurgeon recommended. He is very EDS aware and sees a lot of my neurosurgeon's patients. And so my jaw has actually been dislocated for almost 2 years now. And so I can barely open it. My opening is really limited. And since my fusion surgery, it's been a bit worse. And so we are hopeful that this doctor will be able to help me. Over the last few years, I've seen some physical therapists, and I've had a couple of procedures under anesthesia to try to pop my jaw back in, but it just came right back out afterwards, so nothing was successful. One of the procedures I had was called arthrocentesis, and nothing has worked so far. My jaw PT fired me and said I needed to have surgery, and anyways, we put it off because I've had a lot of more pressing issues going on, but it still is something that's important and needs to be taken care of. So we're hopeful that this doctor will be able to help. He is not a surgeon, so if he does say that I need to have surgery, then he won't be able to do that, but I am looking forward to hearing what he has to say because of how knowledgeable he is about EDS, and I've heard he's very thorough, so all those things are good things, and I'm just enjoying a fun little road trip with my mom. We're walking in. So we just got back from a 3-hour long appointment at this TMJD specialist. We were very impressed. It went really well. It has been confirmed that my jaw has a lot of problems, but this doctor did a very thorough examination and we felt confident in his recommendations. He did a scan of my jaw and my neck, and he showed us all the degeneration that has been caused, and my jaw is actually like contorted, like totally crooked, and he thinks that the discs are completely out on both sides of my jaw. And he did an exam where he pressed on a bunch of different like points on my neck and my like head and jaw area and my face, and to look for pain and like referred pain. And he was very knowledgeable about EDS, and he kind of talked about like the progression of TMJD and how it kind of starts with like popping and clicking, and then it progresses to like occasional locking, and then it progresses to more like permanent locking, which is what the stage I've been in for a few years. And so unfortunately, like, it has been a long time and we should have been doing something about this earlier, but hopefully it's not too late to start like reversing the damage that has been done. We are going to try to get a jaw appliance made tomorrow morning, and the problem is that my jaw opening is super limited, about 10 millimeters, and normal is 40 millimeters, and so they're trying to get me to 15. They have a special way to make jaw appliances for limited opening, people with limited opening, and so they have a temporary jaw appliance for me that they made that I just am wearing on the front of my teeth when I'm not talking. Where did it go? Oh, right here. It's this nice little jaw appliance to wear on the top teeth, and that's just to hopefully get me to 15 millimeters by tomorrow. I'm also trying some CBD cream and some medication, and they also did some laser treatment all along my jaw and my neck while in the office, and that's supposed to help. So hopefully we can get to 15 millimeters tomorrow and get the impressions. And then once they get the impressions, it takes a few weeks for them to hand make the orthotics. we'll have to come back and get them fitted in a few weeks. And so we'll probably do that when we go see my neurosurgeon for my follow-up in a couple weeks, and kind of time it because driving to Richmond is on the way to Maryland from North Carolina, so that kind of works out well. And the orthotics that they make are one for the daytime and then one for the nighttime. And the daytime one will probably be like 6 months to a year that I'll wear, and then I'll start to like wean off of it. They said in EDS patients it takes a bit longer for everything to like heal and get in the right place with the orthotics. And then so the daytime one is on your bottom teeth and the nighttime one is on your top teeth. And a lot of EDS patients have had success with his orthotics, and so we are hopeful about that. They're unfortunately very expensive, but hopefully it'll be worth it. And we are grateful that we didn't end up doing surgery like so many PTs and doctors had recommended to me. I had been recommended to have jaw surgery, and he said, please do not do jaw surgery. The long-term success rate for jaw surgery is close to 0%, so that's pretty bad, and we're glad that we didn't go ahead and do the surgery. And hopefully this conservative type treatment will help with my jaw opening and alignment, and also my pain and symptoms, of course. He also did mention that my airway is very narrow, which of course we knew because of the difficult intubation. He saw that on the scans, and he also wants me to have another sleep study done because Jake had noticed that it sounds like I'm having more trouble breathing at night when I'm sleeping. So it'd be great if we could find out what's going on there. And yeah, that's about it. We're back at the hotel and just resting, and we'll probably get some dinner in a little while. And everything has gone pretty well. So let's take a moment to celebrate that this is my very last antibiotic pill. It has been over 3 weeks since I started antibiotics, so we're excited to be done. And thankfully my incision is healing well and everything looks good so far. I still have a week left until the rest of my stitches are taken out, but all is well. Hello! So this morning my mom and I went to my second appointment with the jaw specialist to try to get the impressions for this jaw appliance that is being made to try and get my jaw in a better position. And unfortunately it was pretty tough to do because of my very limited opening. He wanted to be able to do this special type of scan that works really well, but they have to put this camera like inside your mouth to get all of your teeth and the back teeth. And they tried to do that. They numbed up my jaw joints and did laser therapy and gave me pain medication and tried to like open it up, and that actually took hours, and we weren't able to get my jaw open enough for that. But thankfully we were able to get my jaw open enough to do just impressions where they do that like foamy stuff that they press down to get a mold of your teeth. And so they were able to do that. He had to use like a special plastic type because the metal type just like would not go in no matter what. But we were there for 4 hours. Yesterday's appointment was 3 hours long. Today's was 4 hours long. And so we were really thankful for all the time that they spent with us and how hard they tried to get the impressions done for me. They actually did when they numbed up my jaw joints, they actually did an injection of Prolotherapy, which is what my neurosurgeon has actually recommended that I do in my neck as well. So that was kind of cool. It'll be interesting to see how that goes over the next few days and weeks. And so we are going to be coming back to Virginia in a few weeks to get my appliances fitted noticed today that he actually created the lasers that they use, and he is letting us borrow one of his lasers to use for the next few weeks until we come back, and that's supposed to really help with healing. And they actually recommended that I use it on my incision, which is supposed to help with healing and reduce scarring, which is pretty cool. That doctor was actually really excited about my shirt that says I've got issues with my tissues, Ehlers Danlos syndrome. My friend Jen has a shop called Grace Embrace, which has a lot of really cute like chronic illness apparel, and she designed this shirt, and my sweet friend Nicole bought it for me, and I love it. And I got a lot of compliments in the office about it. The receptionist thought it was really cool, and actually one of the doctors there asked if he could take a picture of me wearing it because he liked it so much. So he also gave me some things to wear at night, like to open up my nasal passages, because those are very narrow. My airway in general is very narrow, so we're going to be getting another sleep study done in the next few weeks, and see what's going on there with my breathing at night. And I have these temporary appliances that I'm going to be wearing for the next few weeks as much as I can. You really can't talk in them, which is unfortunate, so you have to take them off to be able to talk normally. They feel pretty funny, but they're supposed to bring like your jaw forward into a better position. Once I get the jaw appliances, I'm going to have two. The top one is at night, and the bottom one is during the day. And I think they said like 6 to 9 months or so with the bottom one in during the day as much as you possibly can, and then you'll wean off of that and then like continue using the top one for the rest of your life. And so that's not a big deal. You just wear it when you go to sleep. It's like a retainer. And overall the trip went well, and my mom and I had a good time together. I don't know if she likes being on the camera. I don't really like being on the camera myself. But anyways, we got some Five Guys after the appointment, and now we're on the way back home. Five Guys are my absolute favorite fries in the entire world. Yeah. And for some reason, if I'm like nauseous or don't have an appetite, that's like the one thing that I'm like, maybe I could go for some Five Guys fries. So that's like the one thing that like almost always tastes good to me. So yep. Anyways, that was our trip to Virginia. And if anyone wants to hear more about this doctor that I have seen, feel free to message me. I definitely would recommend him if you have EDS. It's very thorough and very caring. So yep, I hope you guys are doing okay.